it's Leela, the proud poly kinky queer slut. Today's question is, what is PrEP? So PrEP stands for pre-exposure prophylaxis, and it is a name for a class of medicines. There are two, I think, that are approved by the FDA right now that a person can take if their risk of contracting HIV is high to significantly reduce that risk. So it's basically like an AIDS vaccine, except for that it's a pill that one takes every day or a series of long-lasting injections. Um, it is one of the many factors that has changed the landscape of how we can view AIDS now. HIV and AIDS is no longer the deadly, crazy deadly, virulent epidemic that it used to be. It's still a serious medical concern, of course, and we still take precautions to protect ourselves from STIs as a matter of responsibility. But it is such a relief to know that it's no longer the death sentence that it used to be. And, for me, I was raised in an era, 90s ish, when there was just scares, just so afraid of getting AIDS because it was a death sentence. And not only that, but a shame sentence and a death sentence. And while it's still something of a shame sentence, and it certainly does still kill people, it doesn't kill people at nearly the rates it used to. There is something I'll link to in the notes, which is an article about some stories that GLAAD did about profiles of people that are 50 and older and living with HIV. There were we've now reached a point in modern medicine where people can live with HIV as a chronic condition. Not everybody, certainly people still do die of it, but people live long, happy lives as people with HIV. And knowing that's important because countering stigma, countering fear is really helpful in making rational choices in your life and deciding on your risk levels. But also, a lot of what we learned through the AIDS epidemic was how much people were othered and shamed because of contracting a disease that is often contracted through IV drug use or sex. And combating that shame, combating that fear, combating that stigma can be super powerful. So, a lot of things factor into a person's decisions when it comes to STI risks and when it comes to what they want to do, what medications they want to take. But yeah, there are options out there, and there are things that you can talk to your doctor about. And if your doctor doesn't want to talk to you about these things, Google it and then find yourself a doctor who will, because there are many, many things you can do to just be aware, educate yourself about risk factors, and know what your risks actually are when it comes to HIV, but also any kind of STI. So thank you very much. I appreciate you listening. This is Leela, the proud poly kinky queer slut. Remember, you can ask me anything.